Hi, my name is Morgan. This is my patient Taylor, and we're going to be doing a quick physical assessment. So looking at Taylor, his skin color is even and consistent with his genetic background. It's pinkish tan in color. His pigment is even. The texture is smooth, firm, and uniformly thin. There's no edema noted. We're going to check his skin turgor on his hand. So skin turgor is elastic. His skin is dry and no diaphoresis is noted. His temperature is warm and equal to bilateral extremities. And there's no vascularity changes, bruising, or lesions noted. Looking at his nail beds. Nail beds are slightly curved with a 160-degree angle noted. Nail edges are rounded, smooth, and clean. Folds are smooth and rounded. Surface is smooth, regular, non-brittle, or splitting. Uniform thickness is noted. Nail is firmly adhered to his nail bed, and the base is firm on palpation. So looking at his skull is symmetrical and normocephalic. There's no deformities, lumps, or tenderness noted. Temporal artery is palpable, and it's over the zygomatic bone. His temporal mandibular joint. Go ahead and open your mouth. Good. Close it. Movement is smooth, no tenderness noted. His facial expression is appropriate to behavior. Facial structures such as his eyebrows, palpable fissures, nasolabial folds, and sides of his mouth are symmetric. I'm going to assess his sinuses, his maxillary and frontal sinuses. Any pain?
No.
How about now?
No.
So no tenderness or pain noted. If his sinuses were tender, we would take a light or an ophthalmoscope and put it on his bone right here and shine it in there and have him open his eye. Open his mouth. If the light were able to shine through, that would mean that he wouldn't have an infection. Usually with an infection, it fills up with fluid, and that light wouldn't be able to be seen inside of his mouth. We're going to check his optic nerve with our light. So the optic nerve has no opacities noted. It's round in shape, and the color is yellowish-orange. We're going to check the 6 cardinal positions. So follow my pen, don't move your head. Good. So he's able to successfully follow all of the positions and no nystagmus noted. Now we're going to do the Snellen chart. He obviously has glasses on, so he's going to keep his glasses on. If you could just cover your right eye for me and read the smallest line that you can see.
KGFONPX.
Good. And then cover your other eye and do the same thing.
KGFONPX.
Good. And usually he would be standing about 20 feet away from the sign, so his vision is 20/20. Next, we're going to look into his eyes with our ophthalmoscope again. Okay, his conjunctiva are clear, and they're pink over his lower lids and clear over his sclera. His sclera are white. There's no color changes noted, and no foreign bodies or lesions noted. His cornea is smooth and clear with no opacities noted, and his iris is round and flat, and even coloration is noted. So now we're going to check into his ear. So looking at his ears, they're equal in size bilaterally. There's no thickening or swelling noted. Any pain?
No.
How about now?
No.
So when the auricle or the tragus are palpated, there's no signs of discomfort. We're going to look into his ear canal. And you hold the pinna of the ear up and backwards. So the tympanic membrane is shiny and translucent, and it's pearl gray in color, and the membrane is intact. Now we're going to check cranial nerve 8 and check the patient's hearing. So I'm going to stand at a little bit of a distance. I'm going to whisper 3 words to him, and he's going to be able to repeat them.
Hot dog. Car. Pillow. Computer. Glasses. Sock.
So the patient's able to hear bilaterally. Now we're going to check his nose. Looking at his nose, it's symmetric and he's got no lesions noted. We're going to check for patency. Go ahead and breathe. And again. So bilateral nostrils are patent. We're going to take our ophthalmoscope or some sort of light and look in his nose. And his nasal mucosa are red in color and moist. There's no deviation noted in his septum. No perforation or bleeding is noted. Middle and inferior turbinates are noted, and they're red in color and moist. No swelling is noted. And then exudate or polyps are not present. So next we're going to look at his mouth. If you could open up your mouth for me. Stick your tongue out and say ah. Good. His mucosa are pink, moist, and intact. Teeth are white in color and free from debris or decay. Teeth are straight and evenly spread. There's no missing teeth noted. Gums are pink in color. No lesions, bleeding, or discoloration present. And no gingival retraction is noted. His anterior hard palate and soft posterior palate are noted. The anterior hard palate is white in color, and irregular transverse rugae is noted. The posterior soft palate is pink in color, smooth, and movement is noted. No torus plantaneous is noted. His tonsils are noted bilaterally. They're pink and moist, and no swelling or tenderness is noted. His uvula and soft palate rise in the midline. Tonsillar pilaris move medially, and his gag reflex is noted. The tongue is midline, and lingual speech is clear and distinct. So looking at his neck, it's symmetric with no lumps or deformities noted.
Nope.
And no tenderness noted. We're going to assess his cervical lymph nodes. And they are non-palpable and non-tender. Next, we're going to assess his carotid pulse, which is strong and regular bilaterally. And then we will auscultate for bruit. So now we're going to look at his trachea. Trachea appears to be midline and symmetric. We're going to assess his cranial nerve 11. So I'm going to press on your face and try and push your head that way. Good. We are going to assess his thyroid gland. So I'm going to have you take a drink of this. Go ahead. Swallow. So his thyroid moves up and down with swallowing, no tenderness or swelling noted, and it's symmetrical on both sides. Now we're going to look at his chest. His thoracic cage is symmetrical, and his shoulders and muscles are symmetrical. I'm going to have him take off his shirt. Okay, so when he when he breathes normally, he's got symmetric expansion. We're going to assess for tactile fremitus. So I'm going to listen to your back, and you're going to repeat blue moon. Okay?
Blue moon.
Okay?
Blue moon.
Okay?
Blue moon. Blue moon.
And usually we would listen in the 10 areas. There's no lumps or tenderness noted. I'm going to assess his spinous process. So his spinous process is straight and non-tender. His respirations are regular and non-labored. His respiratory rate we would assess for a full minute. It's 20 breaths per minute. Now we're going to assess his lung sounds, which are best auscultated with your stethoscope on the bare skin. Deep breath. Breath sounds are clear and no adventition sounds are noted. And you would usually assess that in a Z pattern. Now we're going to go to his upper extremities. We're going to assess his epitrochlear and axillary lymph nodes. And they are non-palpable and non-tender. Now we're going to assess his range of motion and his muscle strength. The patient is in good physical appearance and muscle strength should be strong. So you need to just move your arms up and down. Okay, and then move your arms like this. So full range of motion with no limitations or tenderness noted. Now we're going to listen to his heart. We're going to listen to his heart sounds in the 5 areas, and we're also going to listen to his apical pulse, starting with his apical pulse, which will be in his 5th intercostal space and his midclavicular line. And you would usually assess that for a full minute. So there's no pulsations or heave noted, and then his beat is regular and strong. You can kind of see, it's hard to see on the camera, you can kind of see the pulsations from his heartbeat in his epigastric area. So now we're going to listen to the 5 locations of the heart, starting with the aortic area. And then moving to the pulmonic area, to the Erb's point, to the tricuspid area, to the mitral area. And no murmurs are auscultated. So now we're going to check for his radial and ulnar pulses. So if you could just hold out your arm for me. And they are about a 2+. And doing the modified Allen test, we're going to occlude off both arteries here. Until the skin changes color and is no longer blanchable. Squeeze your fist for me a couple of times. Good, and then you release of the ulnar artery and color comes back to his extremities. So he has a positive modifying Allen's test, which means that his ulnar artery has good blood flow. So next we would assess his external jugular veins, which if he were supine, they would be collapsed and not able to visualize. We're going to move on to his abdomen, which is flat and non-distended, and it's symmetric with his breathing. I'm going to listen to his bowel sounds in all 4 quadrants. So he has active, high-pitched vowel sounds in all 4 quadrants. And then we would assess his femoral pulse, which was also a 2+, and his inguinal nodes, lymph nodes, are non-palpable and non-tender. Moving on to his lower extremities, he's got no varicose veins noted. His popliteal, dorsalis pedis, and pretibial pulses are all +2. We'll assess them. Popliteal is behind his knee. Dorsalis pedis is on the top of his foot. And then the pretibial is around his ankle, and they're all 2+. Can you go ahead and flex him? Extend your foot. Good. Any pain in your calf? So no calf pain is noted. Range of motion is smooth with no discomfort, tenderness, or limitations noted. He's able to bend his knees and move his ankles and feet smoothly with no discomfort or tenderness or limitations noted. I'm going to have him close his eyes and see if he can sense light touch versus a pinprick. So close your eyes. Good.
Yep. Yep. Yep.
Good. So now we're going to do the finger to nose test. I'm going to have you take your index finger and touch my index finger and then touch your nose. patient is able to complete that successfully, smoothly, and rhythmically. And next we're going to do the heel to shin test. So go ahead and take your heel and rub it up and down your shin, and then on the other side as well. And patient is able to complete that smoothly and rhythmically as well. So now we're going to do the deep tendon reflexes. Usually we would take a reflex hammer, and we are going to do the biceps. So positive reflexes noted, and then we're going to do his tricep. Go ahead and hang your arm just comfortably like that. Good. We would do the Achilles. Let me see your foot. Good. And then we would do the Babinski reflex, which is taking a sharper object on the bottom of the foot, and you rub it from the heel to the toes and watch the toes fan out. So now we're going to assess the patient's gait. If you could get up and walk back and forth through the kitchen. So he's able to successfully ambulate in a smooth rhythmic motion. His gait is coordinated and opposing arm swings naturally and appropriately. The patient is able to keep his balance. Now I'm going to have you do the same thing except put your heel to your toe. And patient is able to ambulate successfully. Good. And how about walk back on your tiptoes? Good. And can you touch your toes? Good. And now we're going to assess the Romberg test. I'm going to have you stand there, scoot back a little bit, with your eyes closed. And patient has a negative Romberg test. He's able to keep his balance. Okay, you can have a seat. Patient is able to perform a shallow knee bend smoothly and coordinated without any limitations or signs of discomfort. And then next and last, we're going to do the range of motion of his spine. So if you could stand up for me. And I'm going to have you bend over about halfway. Further, like you're good. So patient has successful flexion to 90 degrees. Okay, and then go ahead and bend backwards as far as you can. Successful extension to about 30 degrees. And then go ahead and bend to your side. Successful bending to 35 degrees on the other side. Good. Bilaterally. And then we're going to assess bilateral rotation. So if you can twist for me. Good. And again. Good. And bilateral rotation is to 30 degrees. So that concludes our assessment. Thank you.